Ultimate Health will be 17 years old. So by current updates, we're talking over 304 deaths, most of them in the epicenter in China. Over 14,000 infections worldwide. I'll get the update shortly. But with me in the studio, I have Professor William Ampofo. He's head of virology at the Noguchi Memorial Institute for Medical Research here in Ghana. He'll be giving us the update. What are the real facts and figures? What are fears? And what has been the national and indeed global response? Also on the phone line shortly, I'll be speaking with Dr. Bertha Sewa Ayi, Adjunct Assistant Professor of Medicine at the Nebraska Medical Center, USA, and also an adjunct lecturer with UDS here in Ghana. She's a board-certified infectious disease specialist. We'll be looking at what the coronavirus is, what the real risk potential is, and what the way forward is for Ghana and indeed for the world. Remember, tell a friend to tell a friend. We're live on Facebook and YouTube. This is Ultimate Health on Joy 99.7 FM. We're talking about the facts, the fears, and informed action with regard to the coronavirus outbreak. In the studio with me is Professor Ampofo. Prof, you're welcome.
Thank you very much.
Always a pleasure to have you. And I always have you at difficult times.
Well, I guess it's the nature of the job.
Right. And Noguchi has always been at the forefront when it comes to our response, our understanding, and even our evaluation of the risk, actual, and potential when it comes to these kinds of things. But bring us up to speed. I've been doing a lot of reading. My current updates suggest that we've topped 300 deaths. And just a couple of hours ago, we've recorded a death outside China in the Philippines. So if you can just bring us up to speed with what is going on with regard to the coronavirus outbreak.
Well, I think my comment on that would be that these updates come very, very frequently. At least I think every 6 hours you have updates from the WHO website on the total numbers, the places where people have been infected, and as you just said, the number of fatalities. But I would like to caution that it's sometimes a bit difficult to deal with the numbers because this is a new virus. You're dealing with estimates most of the time. I mean, there are some projections that are looking at over 50,000 people probably infected. So when you deal with the actual number of confirmed cases and you take the number of people who have been actually tested, you find that the actual rate is just under 2%.
Right.
So even if you keep track of the numbers each day, these will change rapidly as the numbers go up.
Okay.
So right now we know that, yes, over 11,000 people infected. We have about 300 people who have died. We have the first death outside China. We have no cases, reported in Africa. Those are the stats that, concern us, and those are the ones that we like to focus on. We were happy to hear that the suspected case in neighboring Cote d'Ivoire was actually negative for the new coronavirus, and those are the things that, matter to us.
Okay, right. I've seen a list that suggests that Ghana is part of 13 countries in the West African sub-region or on the continent that are more likely to be at risk because of the high volumes of movement, trade, etc., between us and China, the epicenter of this outbreak? Is that something that we can deal with factually?
Yes, that's correct. That's a natural analysis that is done, in these situations. The risk analysis was also done during the Ebola outbreak. Remember that because we are a West African country, the risk and movement of people across, the ECOWAS region. And so it was not surprising that Ghana was identified as one of the countries that was at risk. And remember, the UN response was actually located in Accra because there was a UN center here in Ghana.
Right.
Now, for this virus, the assessment has been done looking at the amount of travel, trade, movement of people between West Africa and China, which has been the source of this, new virus. So it's Ghana, Nigeria, and a couple of other countries that have been identified. And yes, the analysis just tell us, we don't have direct flights coming in from China, but we have a lot of intermediary flights that have been moving people up and down, and we have a lot of interactions with China. We have a lot of business engagements. So that analysis, I think, is spot on, and it enables us then to look at our preparations and look at where we can prepare best, because I think that the virus is already around, and it's just a matter of time before we, see what it's doing and how we can best deal with it.
Okay, right. Let me just come to the WHO statement. And I think on the 30th, the Director General finally declared it a public health emergency of international concern. What really does that mean?
Well, that means, as he explained, that the virus is now moving, in several countries, and therefore declaring it as a fake enables the WHO to support those.
Fake is the abbreviation, right?
Yes.
Okay.
Yes.
Public health emergency of international right. Fake. Okay.
So it enables the WHO to allocate resources to the other countries that, like Ghana, which are at risk, doing the analysis, and then these countries that therefore follow the guidance, to prepare and have their health systems, and able to deal with this.
Okay, right. That means that Ghana has been positioned and has been alerted by the world body to now take this very, very, very seriously.
Yes, as per the risk analysis that you just mentioned, that shows that Ghana, Nigeria, and other countries are at risk because of the amount of movement and goods and services between, China and our part of the world. Okay.
Prof, if you could just school us, especially our listeners worldwide, what is the coronavirus? And I know Noguchi has done some work over the years, and it's a bit alarming when we hear that, well, this is the same virus that causes the common cold, right? But this is a new strain. What are we dealing with?
Well, let's just do the basics. There are a couple of viruses that are associated with, cough, sneezing, catarrh, etc. There are a group of them, several of them actually.
Okay.
So we have the rhinovirus, we have the coronaviruses, we have the influenza viruses, we have some of the adenoviruses.
Okay.
But what we do know is that the ones that seem to be associated with severe disease during certain times of the year, the influenza viruses, for example. So these have become a public health strategy where we have vaccines that are produced, specifically to deal with the circulating strain that we know.
Okay.
And it's a kind of a guessing game to try and get the best vaccine to match which was the circulating strain before that. That is for flu.
Right.
So for these other viruses, there are no vaccines that are actually being used to manage them because of the less severe impact that they have on public health.
Okay.
So we know, for example, there are estimates for the number of people who die from influenza. It affects the infants, it affects the elderly. We have health workers who are at risk. We have pregnant women who are at risk. So there are WHO guidelines that recommend the use of immunization, targeting these key groups if you take influenza. For coronaviruses, let me reflect and let's take us back to the era of SARS.
Right.
That was the new coronavirus that emerged, caused considerable anxiety because
SARS was 2002. 2003.
2002, 2003.
Right.
Cases in Hong Kong. It affected a lot of tourism.
Severe acute respiratory syndrome.
Exactly.
Okay.
So SARS belongs to the group of coronaviruses. So I'm giving that reference because it is one coronavirus that when it emerged in humans, it was alleged to have moved from bats through civet cats, through some, market situation, and then started becoming transmissible amongst humans.
Okay.
So that is the reference point for a virus that also caused a lot of international concern.
Okay.
It actually led to the creation of the Public Health Agency of Canada.
Right.
And various measures were put to, deal with this. Unfortunately, it caused some fatal illness in hospital workers, in doctors and nurses who, were treating the first line of people who had this SARS virus. So it is that memory which, has led to some concern about this new coronavirus. But there are other, there are about 4 normal coronaviruses that we know occur in humans, which are associated with less severe disease. Okay. And we also know the other one, which is of concern, which is called the Middle East Respiratory Syndrome, the MERS virus. And this work has been done, and this is circulating in Saudi Arabia.
Still?
Yes. There's still reports of cases associated with contact with camels. So the good thing for MERS coronavirus, virus is that it's not yet transmissible amongst humans.
Okay.
So the cases that are being monitored are always associated with some contact with camels.
Okay.
Okay. But there are some, interest in monitoring this virus. So, for example, in Ghana, we've done some work with the Ghana Health Service, the Ministry of Health, screening returning Hajj pilgrims.
Okay.
Who have gone to the Middle East, who've gone to Saudi Arabia.
So this is part of continuing disease surveillance.
Exactly.
Right.
This is a strategy that the Hajj board, together with the Ghana Health Service, put in place to, help support Hajj pilgrims. There is a medical screening that is done before they go.
Okay.
And upon their return. And so those who showed respiratory
So pre-
illness,
and post-Hajj screening?
Yes. So those who showed...
For everybody?
Yes. Yes.
Okay. We're not sampling. We're screening everybody.
Yes, so the sampling was for those who returned and who showed signs of respiratory illness. Right. So this was done at the Hajj village. Actually, we did it in collaboration with the Kumasi Center for Research, KCCR. Right. And we did find that, yes, some of the returning Hajj pilgrims who showed signs of illness, which is catarrh, cough, fever, headache, they did have a respiratory virus, but it was not the MERS coronavirus. Okay. They had, seasonal flu viruses.
All right. Prof, just with your permission, if you just joined us, this is Ultimate Health on Joy 99.7 FM. You just heard speaking Professor William Ampofo. He's head of virology at the Noguchi Memorial Institute for Medical Research here in Ghana. We're talking about the coronavirus outbreak, the novel coronavirus outbreak. Started in Wuhan in China. Now we know it is active and has been confirmed in several countries, I believe now over 20 countries. Over 300 people are recorded to have died as a result of this virus, and there are over, I think, 14,000 identified or suspected cases of the coronavirus. We're trying to understand what it is and what, risk it poses, and how the international community should be responding, and then look at Ghana's response. So Prof. Ampofo is well positioned to speak to this specific angle of it. We'll also shortly be speaking to Dr. Bertha Ayi, an adjunct assistant professor of medicine at the Nebraska Medical Center in the U.S. She's a board-certified infectious disease specialist, to get another perspective on this. There have been several responses. Now we're hearing of travel bans, tightened screening and testing that is being done. A lot of emphasis is being placed on air travel, but let's not forget there are various ports of entry and of movement, and we'll be looking at the kind of response mechanisms that we've put in place. Interestingly, I've just monitored that China has finished construction, handing over an operationalization of a medical center specifically to deal with this within what I would consider record time. The WHO is concerned about the response and the risk of exposure for countries with weaker health systems. And again, another thing I'll be bringing to Prof. and Doc Ayi when I bring them in is this transparency in reporting and documenting of cases and case profiles and the responses across international borders. Very, very, very important. Prof, just as I mentioned that, I see you looking at me, but it's critical and essential that countries share information quickly on some of these outbreaks, is it not?
Exactly. So that's what China did.
Right.
That they started seeing these cases.
They are required to do so by best practice, or is it by law, international law?
By international law. There's International Health Regulations 2005 that every member of the World Health Assembly has signed up to, including Ghana.
Okay.
And it behoves upon all member states to share information about rumors, any kinds of disease. There are a list of issues and checklists that the countries know that they have to. And
so China has been fully compliant. And indeed, the Director General praised them for that. Okay.
Not only that, they shared the sequence of the virus. You talked about testing, and it's enabled the quick development of ability to diagnose this new virus. And this is incredible.
All right. Okay. Now, let's look at what we're dealing with and then how it dovetails into policy and response. So we have a respiratory virus.
Exactly.
Right? And it's said that it moved from bats or snakes to humans. Can you just quickly clarify that and whether that is important? That's movement or transmission from animals to humans and then from human to human.
That is the crux of the problem. Because it was not previously known in humans, there's no natural immunity.
Okay.
And therefore we know very little about this virus. So the analysis so far on the initial reports show that yes, most of the first 100 cases and the first deaths were all linked to that particular market in Wuhan.
In Wuhan.
And in that market there is that possibility that the variety of animals, including it was actually a seafood market.
Right.
Okay, but there are also live animals there. And some analysis on the sequence of the new virus has found a match with the virus that is found in bats.
Okay.
So that is the speculation right now, that it could have been origin a bat, which there's not much evidence available now.
Okay.
But the importance is that if the natural reservoir is identified, it will enable more work to facilitate research work on, finding out how to deal with this new virus.
Okay. So it's essential that we scope the search so that it can guide the search for a vaccine, it can guide responses, it can guide our understanding of the expected outcome or prognosis.
Not exactly, because now that the virus is transmissible amongst humans, and it could change, and it could change so that it could survive in humans now.
Okay.
So that's the catch with these viruses. It's they are parasites. They're existing in living cells.
Right.
So when they get into humans and they adapt, and then they're able to proliferate and reproduce and mutate faster to avoid the immune response of the human system.
Okay.
So that's what we need to understand.
Right.
So knowing what it was before will enable us to see how it has become.
Right.
And then we can use that information as we design the appropriate interventions, which is vaccines or drugs.
Okay. 25 minutes past the hour of 2. If you just joined us, you're tuned to Ultimate Health on Joy 99.7 FM with me, Nortey by Nature. I'm in the studio with Professor William Ampofo of the Noguchi Memorial Institute for Medical Research. It's a mouthful, but they do serious stuff to protect you and I. We're talking about the outbreak of the coronavirus, the novel coronavirus 2019. Started in Wuhan, China, now spreading, should I say rapidly? I just saw something yesterday, or my attention was drawn to it, that looking at the progression in China, it seems to be doubling itself in almost 6 days. Every 6 days, the numbers double or gallop. We'll be looking at that. But let me ask Prof, before I bring in Dr. Ayi in the U.S., Iowa in the U.S., Prof, there's this disturbing angle of it, which says that even human beings who have been infected and have not yet progressed to showing symptoms are able to transmit or spread this. And since we're screening for symptoms, does it mean that there's a huge possibility that we've missed a lot of people who are asymptomatic and therefore still infectious or contagious?
I don't want to say that it is... how do I say it? It's natural. It's natural for several viruses. It's natural for several viruses that when the virus is being shed, there are no symptoms. Same thing with flu.
Okay.
Look, if health workers, for example, doctors, they're at risk because when the patient comes to the consult room and is coughing, the person could be spreading TB. But they sit there and then they, have to take other precautions and manage the patient. So, yes, there's some viral conditions which will be spread before you detect because of the symptoms that arise. Okay. But that's why we have, evolved and we use vaccines and other appropriate, countermeasures for these viral infections. Okay. In the case of this coronavirus, as I told you, you already have screening that is being done for MERS-CoV, and we use the origin of travel of the person in knowing the information that we have about the new condition. Okay, so that is important. You're not going to screen everybody who arrives at the airport because everybody is healthy. You're looking out for people who have travel associated with the particular region of concern, which in this case is China. And then you'll be looking out for the symptoms associated with illness. But you could have a group of people who could have gone to the Philippines. You could have a group of people who would have gone, to another location. And it's not easy to do mass screening looking for illness even when you have suspicion. It's very difficult. All right. Let me just take your word on Ghana's preparedness, because we've done a lot of work with related, should I say, disease conditions and so on and so forth. Are we prepared to deal with this? I mean, I've seen and heard and read about countries that have quarantine centers and various structures set up, even though they have not had a case. What would be your view on Ghana's preparedness? Well, for my perspective at the Noguchi Memorial Institute for Medical Research, University of Ghana, we do have the ability to test for coronaviruses because we have been working with respiratory viruses for some time. So we have a national influenza center, which provides data on circulating influenza viruses. There are 22 sentinel sites that the Ghana Health Service and the Ghana Armed Forces also have in the medical reception station. So these centers will provide first line, for respiratory disease. So if somebody goes to any of these centers and has a respiratory illness, and his sample is taken, we will be able to tell when it gets to us at Noguchi whether it's an influenza virus or it's a coronavirus. Now, for the novel coronavirus, we have had extensive interactions with our collaborators, and we're actually expecting a shipment of the new coronavirus kit this weekend. So I'm very confident that by next week, Noguchi will be providing testing, be able to provide confirmation or screening. Specific to this particular... Specific to the 2019 novel coronavirus. Right. Yes. We also have support from the WHO and from the CDC, who are making efforts to have these specific reagents available to influenza laboratories so that we can provide screening and testing for coronavirus. We also have a chain of international laboratories who will be able to provide confirmation should we pick up any suspected cases. So for testing, there's quite a solid system that is being set up to deal with suspected cases. The numbers may be a problem if we have several hundreds, but initially we should be able to deal with it. And the Ghana Health Service and the Ministry of Health have a national technical coordinating committee that is mandated to deal with this with such situations. The committee has met once already last week, and there's another meeting that has been called for tomorrow to review the plans that we have. We've also in the past week review the national pandemic influenza preparedness plans, which are specific for respiratory illnesses and should cover the new coronavirus. You sound very, very confident about our response structure, at least our capacity with regard to isolation and diagnosis, right? So where cases are actually found, we will have the boots on the ground and the resources to deal with it? If a suspected case is sent to us, within 6 hours we'll be able to complete testing at Noguchi. Great. After testing, we'll find out what happens. 31 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. We're dealing with this very specific and serious threat of coronavirus, the novel virus 2013. I have on the line now Dr. Beth Ayi. She's an adjunct assistant professor of medicine in the U.S. She's a board-certified infectious disease specialist. Dr. Ayi, thanks for joining us. Hello, Dr. Ayi.
Yes.
Well, good morning to you in Iowa. And thanks for joining us.
Good morning. Yeah, I'm in South Dakota, but yeah, good
South
morning.
Dakota, okay. Right. And I hope you've been able to follow to some extent or some degree my discussions with Prof. Ampafo in the studio.
Yes.
Right. Now, my initial question to you is, what are your comments on the outbreak so far, and maybe the international and national response to this?
Well, the outbreak is certainly spreading to several countries, and it appears, apart from the one patient who was diagnosed in Korea who came from Japan, most or all of the patients who are in other countries, 23 to 26 countries, all came from China. So
right.
Most countries, after the WHO declared this a global public health emergency, have made the decision to actually stop people who are traveled to China in the last 14 days from entering their country. So, for example, in the United States, President Trump signed a law that as of 5 p.m. Eastern Time today, February 2nd, nobody coming from China will be allowed to enter the United States except U.S. citizens and people who are going to come in here anyway. And they should also put themselves into a 14-day quarantine.
Right.
So that is an action the United States has taken, and other countries like Israel, Philippines, Iraq, Bangladesh, Saudi Arabia have taken similar actions. And I think it would be very, very useful if Ghana took a similar action, considering that it is taking people who are coming from China to enter a country to cause it to spread. So U.S., for example, has had its first human-to-human transmission in a couple from Illinois. So,
okay, but wouldn't you say, or let me put it this way, some people say that, locking up the stables after the horse has bolted. How effective are these travel bans? Do they not fuel anxiety and panic, or in this circumstance, this is an appropriate response?
I think this is a very, very appropriate response, because if the patients were coming from elsewhere, then you would say, oh, it's not really a big deal. But since almost every patient who has had a diagnosis in a foreign country came from China, it is extremely important that the travel ban be imposed if the country has the willpower. And this morning I was reading that some countries like Cambodia, they're still playing around with it and saying it doesn't really matter. But those who really mean business and want to make sure it doesn't spread in their country have quickly imposed a travel ban. And earlier I heard you asking, Prof, about secondary transmission in asymptomatic individuals. So
that's right.
The New England Journal of Medicine reported in Germany someone who had a business meeting with somebody from China, and the person had left the country. But then this person had a meeting with 3 other people, and those 3 other people now are also ill, and they got even ill before the index patient who had the contact with the person from China got ill.
Right.
So I think globally, if they're going to control this infection, I think it's extremely important that the ban be placed, especially since the University of Hong Kong has done some viral mathematical modeling to show that if the rate continues as it is, by April, about 150,000 cases will be diagnosed daily in China alone.
Okay, right.
So I think it's extremely important that this measure be taken.
Right, okay. Just hold on a sec for me. I think Prof wanted to make an intervention.
Bethy, that's quite interesting, but my concern is that the travel ban gives the impression that you're actually preventing the virus from entering. But you just said that, there's a period when it's asymptomatic.
Right.
And you already have people who have entered these other countries and have been found to be ill. How did they enter? They flew in. On that flight, you had other passengers. On that flight, you had air crew. I haven't heard anything about those people who were on those flights being monitored or any information about those who traveled with these identified cases. So my impression is that, as Nortey said, the horse has already left the stable. We are finding those people who are sick and who had contacts with people from China, But as you just said, there was secondary transmission, and those other people even got ill before the index point of contact. So I think that the travel ban, yes, it will help to contain more, cases from the source in China. But I think there should be discussion, about what we are doing, because we are already probably having, cases which we are not identifying because we are looking only at travel from China. I think we should be looking at.
So we should widen the net.
Yeah, we should. We're already looking for flu viruses in people who have influenza-like illness. I think
Prof, let me just cut in here, because reading the Director General of the WHO statement, he said this was a time for solidarity. And initially in that statement also discouraged the use of such trade bans and travel bans and a few other things. But again, listening to Dr. Ayi, it looks like there are specific scenarios or factors that justify some of these things. Where should we be heading? I'll bring Dr. Ayi back in a second.
Okay. So these are member state decisions. The guidance from WHO is recommendations, okay? So member states do their own analysis, and then they decide what is best for their country.
Okay.
So I'm saying that look beyond the travel bans.
Okay.
Look at the possibility that you already
have people walking around who have this.
Exactly. So we need to enhance our health systems. That's why I mentioned the flu surveillance system, because it's the same symptoms that these people will present with. So if we enhance our sentinel systems, we enhance our systems to deal with people who have respiratory illness, which is focused on flu, and expand it to include coronavirus, we'll have a better chance of managing people who have the coronavirus infection.
All right, let me just remind our listeners, we're live on Facebook and YouTube. We're talking about the coronavirus outbreak in China. I have in the studio with me, you just heard him speaking, Professor William Ampofo, Head of Virology at the Noguchi Memorial Institute for Medical Research. On the phone line, I have Dr. Beth Ayi. She's an infectious disease specialist in South Dakota. Dr. Ayi, any comments on the response from Prof?
I wasn't able to hear it. I lost sound for quite a bit.
Right, but he's suggesting that perhaps we should focus on identifying cases, and that the travel bans necessarily may not, optimize our response. We should be looking at other things, and the horse has already bolted, as I suggested.
Well, not a complete travel ban, but at least some type of inquiry that asks whether a traveler has been to China within the last 14 days. And it doesn't have to be focused on just Chinese travelers, because like the German case, the person was not Chinese. They were actually a Singaporean who had gone to China. But I suppose the point is at least making sure that if somebody's been to China, and specifically the Wuhan district in the last 14 days, some type of questions be put in place to make sure that either the person quarantines themselves, or we make sure that if they're coming from there, like if you can prevent it, we don't want to wait till they're in the country before we try to contain it. So that's the caveat I would make to it.
Right. Okay, let me ask further, following identification of cases, what is the protocol? What happens? We confirm a case, we isolate the case. In the instance of the U.S., what is the rollout?
So the first patient who was diagnosed was admitted to a hospital. They were placed in, at least in this country, there are institution airborne precautions, meaning the air in the patient's room is literally emptied out so it doesn't spread to the hospital. The patient was put on antibiotics, and they were put on some antiviral treatment just to see if it's going to make any difference. And I think as of yesterday, the patient was still in the hospital, and they were getting better, but they had some fevers, and nobody has died as of yet. But the point is to make sure that individual patient gets well and doesn't transmit to any other person, like the couple in Illinois. Okay,
so essentially high standards of infection prevention.
Exactly.
Right. Now, can you say anything about those? I mean, you're in the field. What about those who recovered from this virus? They were identified, but they got well. Is there any research, evidence, anything empirical about these patients, and are they remarkable in any way?
Well, I think that over the next few days and weeks, we would find out more. But the experience from China, where of course most of the patients have been, was that those who got well were discharged home. It is unclear, or it's not been documented anywhere, the kind of instructions they received and whether they were going to collect specimen from them maybe every week or every day to see if they're still shedding virus. But what we do know is that the virus has been isolated from stool. You can find it in the urine. You can find it in blood and respiratory specimens. So what we don't know at this time, or the key piece of information that would help us decide, is whether after they recover, they're still shedding virus in the stool, urine, respiratory specimens, etc. But they got discharged home.
Right. And in all of these instances, I guess that follow-up investigation is being done, or?
Honestly, I don't know. At least China hasn't. I haven't seen. I've been trying to keep up with all the literature that's being published, and I haven't seen anything in reference to follow-up for those who have been discharged. And I think that is partly related to the fact that even the healthcare systems in China are extremely overwhelmed. So they're focusing on the sick versus, okay, what happens to those who have gone home?
Right. Okay. So any words, any advice you would have for us in Ghana? I mean, you have the benefit of maybe a stronger health response system, but any words of advice, any suggestions you'd like to offer?
I think my first one is education, 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 because I see a lot of it. In other words, people should try and actually obtain the facts, and I believe the government is going to do what they can to do that, obtain the facts about the illness, and let people know, assure people that it has not arrived in the borders of Ghana, that we already have coronaviruses circulating in Ghana. It's not new. I've had intellectuals sending me messages that, the coronavirus is made up, it's in Ghana, wear masks. So essentially, people should not panic. It's not in Ghana. Learn about it, keep updated. Even if you have a neighbor next door, let's assume the worst scenario, it arrives in Ghana.
Right.
People will do much better if they know what to do and what not to do than just panicking. Because if your next door neighbor comes home and they've been confirmed with coronavirus, and you understand that, well, if I don't go to their house, I'm not going to get infected because it's not airborne. It's transmitted through droplets. If I stay in my house and the person stays in their house, I don't have to panic. And that if I keep washing my hands and making sure that so long as the person is sick, I don't go near, I'm going to be fine. So I think those are the basic things: education and having a calmness and knowing that WHO, China, the government of Ghana, everybody is doing their best to make sure that it doesn't spread. And the fact that it has no cure, there's no vaccine, and so protection and understanding what's going on is key.
Right. Great. Thanks for sharing that with us. Education, protection, and prevention, and then a calm, informed response. Does that summarize what you just shared?
Yes.
Okay. Thank you so much, Dr. Beth Ayi. She's an infectious disease specialist in South Dakota in the UAE, sharing with us. Back in the studio, I have Prof. Ampofo, and I'm going to activate the phone lines as well. If you have any questions or concerns to address, 0302-216-541. Prof, any responses to what she shared?
Well, I am looking at it from, our national perspective.
Right. You can just get closer to the mic, yeah. Mm-hmm.
I'm looking at it from a national perspective and the number of flights and interactions that we have.
Okay.
So the national response to this situation has already identified, how to manage suspected cases.
So there is a national plan. There is a national response.
Yes, there is a plan.
Okay.
But the scale of the response would depend on how the cases that we find will pan out. Mm-hmm. Okay, so I'll give you a scenario. There was an Emirates flight that landed in New York.
Okay.
And had serious respiratory illness among some of the passengers and some of the crew.
Okay.
The response that...
This is within this outbreak? Or?
No, I'm talking about last year.
Last year, okay.
It was a whole flight, over 230 something passengers were quarantined.
Okay.
They had to commandeer how many buses? You take one bus, that's what?
Right.
50 people. They had to commandeer at least 8 or 9, 10 buses to move these people. I think they used a school gymnasium, okay, to keep. This was the entire crew and passengers.
Okay.
And then they had to set up, emergency beds, etc., and then put in testing. So the test results came out after 2 days, and it was found that they had a strain of influenza.
Okay.
It was most unusual for influenza to cause severe illness in a flight that was about 12 hours. Okay, 12 hours. Because the assumption was that it spread from some passengers to some of the crew. Because any crew who would board an airplane.
In this instance, there was a system or a protocol that picked it up.
Exactly, but I'm just telling you that the report showed that it was a very significant challenge.
Right.
To quarantine a whole flight of close to 300
people. So the operational realities of it itself
are very challenging.
Okay.
So in this case, I think they kept them for two days.
Okay.
And then they moved the sick ones to hospital and the others were free to go.
Okay.
So I'm looking at our local situation, okay? If we find a couple of people on a flight and they have had contact with China, the initial, management and the testing, but then the extent then of doing contact tracing, and then the implications thereof. Those are the issues that the Ghana Health Service and Ministry is,
Well, you sit on a body, and there's supposed to be a meeting tomorrow. Let me ask this question.
Yes.
So, okay, so let's say we find it. Are we going to say that this is just too big operationally, that something might be allowed to slip, or do we have the capacity?
No, I'm explaining to you the challenge, the nature of the challenge,
right?
So that people understand the context that
Having understood the context, I'm saying that should Ghana, for example, touch wood, find that there is something of significance by way of influenza or something on board a flight, will we be able to mobilize this response, isolate these people, and do the needful? Or are we going to say, well, we're waiting for these supplies to come and this hasn't been okayed and no money? Because in China, they are injecting huge amounts of money to deal with this.
So I'm not one of the emergency response workers, but I do know that there is, an emergency plan at the airport.
Okay.
We've had this before. Remember, there was a major accident when a cargo flight overshot the runway and crashed into.
Okay.
There was an immediate response. Remember,
the
appropriate actions were taken. The area was sealed off. Medical care was provided to the injured. So that scenario is something that is practiced and it's planned for.
Okay.
I'm just saying that in the case where you have one suspected patient or person on a flight, a whole flight, it then makes you have to understand the perspective of the situation.
Right.
And I think that resources are being marshaled for the appropriate response.
Okay.
But as Beth has said, it will have to be good understanding.
Right.
And not panic.
Okay.
I'm worried about if people start putting out all kinds of things. Hey, there's a flight. People have been confined. The virus has come to Ghana. Then you have all kinds of, panic and.
Well, Prof, that's essentially why we have you in the studio. We want to understand that if even it is classified as a suspected case, we have the wherewithal, the men, the boots on the ground, the resources to deal with this. This is, I think, what Ghanaians are expecting to understand and hear.
I don't think that Ghana will build a hospital in 2 weeks. I think Ghana will use its available resources to respond appropriately to whatever situations that we find. I'm giving you clear, dimensions. We cannot build a hospital in 10 days, okay?
Right.
But we will, try and see what we have existing that can be adapted to deal with what we find.
Okay.
Yeah.
And you are happy with that capacity to adapt, so to speak?
That's what we have, so that's what we will manage with.
Okay. Right. Let me also ask this. I read that there's new information or should I say, concern over the action of the virus on the digestive system. Have you come across this? It's been implicated in some form of or issue with regard to its spread.
No, I haven't yet read about that. But as I said, we've done some work on coronaviruses before.
Okay.
So we know that there are human coronaviruses that are in all over, including Ghana. Not this new novel coronavirus. There are people who have shown up with flu who have not had the flu virus, and we found about 4% of them had the normal human coronaviruses.
Okay.
We've done a study in a high-risk area where there's a lot of interaction between people and animals. We didn't find any coronaviruses that had moved from bats to humans in Ghana.
Right.
So the context, I think, has to be understood.
Right.
That because it's a new virus, there's a lot of concern because there is no vaccine, and we are now developing, on the international stage, appropriate countermeasures. But I think that as we have discussed, it's important to understand that we need to have appropriate preparedness plans.
Okay. Right.
We're dealing with a respiratory virus before we're dealing with Ebola.
Okay.
So it's necessary to have improvements in our health system.
Right.
I'm an advocate for vaccine manufacturing. I represent...
Are you still on the African Vaccine Initiative?
I still chair the African Vaccine Manufacturing Initiative. And I need to take this opportunity to say that, look, if we could manufacture our own vaccines in Africa, I mean, this would be one step forward to dealing with such emergencies.
Okay, what stops us?
Well, it's what we're trying to do is develop a roadmap policy for Africa, so that at the Africa Union and have the member states, and people commit resources. I mean, take the ECOWAS region that we belong to.
Right.
We represent a formidable economic union, which if we were producing a vaccine, we could have our members, apart from just free movement across the borders and defining our trade, would have some level of public health security.
But Prof, our governments laid down commitments to a certain percentage of their budgets for health. They don't stick to these things. And here you are chairing the African Vaccine Initiative, telling us that, look, it'd be great if we were mobilizing resources towards this end. We're not doing it. So we are prisoners to other people's research.
Let me put it this way. We have competing priorities. Okay? So if I talk to the minister and I say, look, why don't we start making a vaccine? He has a daily headache of finding money to pay for the vaccines that we're already using. So this is a medium, long-term plan.
Right.
But I need to talk about it because I think it's important so that the next generation focus on the
So as the head of virology, you're chasing grants and resources to do what the continent needs. And those grants and resources are going to come from outside.
Well, the president says Ghana Beyond Aid. So that's why we're talking about this. That's why we're pushing the agenda that we should include solutions that are homegrown, that are continent, and located, so that we can improve our own public health. Okay.
I've got this on my WhatsApp. It says, I'm glad Prof. Ampofo is talking about the impact of panic. We certainly don't want an epidemic of fear. Right, that's why we're talking facts here. Thanks for that WhatsApp. It looks like there's a problem or headache with the phone lines. You can still WhatsApp. Few minutes left. But let me ask this, Prof. So again, for persons listening to us, sometimes the same epidemic of fear that somebody is suggesting on our WhatsApp line is what will prevent people from reporting signs and symptoms, right? And the kind of transparency and disclosure that we are getting that is helping us program responses will be compromised. What would you say to people out there? If you have any of the signs and symptoms that we've been talking about, cough, the headache,
fever,
flu,
catarrh, running nose, you should go to the hospital immediately.
Right.
I mean, all the work we've done with flu, very few people have died from flu.
Right.
And now the school outbreaks that we've experienced recently, the Ghana Health Service has the antiviral. But how will you get antiviral if you don't go to the hospital?
Right.
Now, even with this new coronavirus, there's been reports that there are 2 antivirals that seem to work, in addition to the supportive treatment for pneumonia, which is a lower respiratory tract infection. So there's knowledge about some measures that work. You won't get better if you sit at home and you drink honey and garlic. You need to go to the hospital.
So we need to identify the case properly.
You need to understand what you're facing.
Right.
But it's not easy because remember we have malaria. People have the same symptoms that mimic influenza, which my own daughter is coughing today. I'm worried. I say, hey, I need to get her checked out. You see.
Okay.
So people need to understand that this is the Harmattan season.
Right.
In the Harmattan season, we have these respiratory illnesses. The best way is always when the thing hits you to go to the hospital and not
Right.
wait when it becomes severe.
Okay.
Because when it progresses to pneumonia, which is affecting your lungs and your chest, hey man, that's a different ball game. It's
Right.
becoming more serious.
Okay, so people should report to their hospitals, and that way they enter the the system, and can be treated accordingly if it is whatever it is.
Exactly.
Right. Okay. And then the last thing, how do we plug in to the international system? Some people are worried about international best standards. I know there are international health regulations. Are we up to par as a country when it comes to compliance?
We are. I told you that we just revised our national pandemic preparedness guidelines last week.
Okay.
We used the guidance from WHO. This was supported by WHO.
Okay.
We have, constant support from the Africa CDC.
All right.
Next week, one of my staff is going on a training on this novel coronavirus organized by the Africa CDC.
Right.
We have constant interaction with WHO.
Mm-hmm.
We have support from the development partners led by CDC.
Right.
So we are constantly engaging with the international partners and following best practices protocols.
Right. Okay. Is it my impression, or are we over-focusing on air travel? Is it the same system we've rolled out at the ports and other places?
I mean, we have a collaboration with Ghana Health Service Vector Surveillance. We do surveillance for other things, in other species, looking for other viruses. And so far, we haven't found any dangerous pathogen that's crossing on the ground. But, the Ghana Health Service has a port health division, which has been put on alert.
Right.
And this covers not just the airports, but also the ground crossings.
Right. So we should be able to pick these up and then move them accordingly within the system.
Exactly.
All right. Last words for our listeners?
Do not panic. Just follow the advice from the Ghana Health Service and the Ministry of Health.
Okay. Many thanks to Prof. William Ampofo, Head of Virology at the Noguchi Memorial Institute, sharing with us what we know to date about the coronavirus. He sounds very, very, very calm and confident, and that is reassuring. And so we'll take that from the Head of Virology, also a chief up there, Nana Owetuo.
Nana Owetuo.
Kwabna Amakwata Tutuohini. Nana, we thank you so much.
It was a pleasure, Nortey. Anytime.
Right. Okay. I got this quickly. Let me read this before I hand over to Bilay. A Methodist hymn. Okay. I thought it was about a flight.
That's very reassuring. We need to,
right, understand
where we're coming from. We need the support and religious stuff also.
Right. Many thanks, Prof. And many thanks to you, my discerning listeners. And many thanks also to Dr. Beth Ai in South Dakota in the U.S. who joined us with an international perspective. We'll keep you updated on this virus. There's a lot of movement on the international scene, but we are told that we can remain calm and follow protocols and report to the hospitals. Once again, thanks to my producer, Abeku Sakofi, and I hand over to another MOBA senior, Bilay Paul Ankra, for Sunday Rhythms. My name is Nortey by nature. I'm out.
All right, people. This is Kwabna, and the 14th of February is a love experience. Come, let's chill. Come, let's hang out. Come with your partner. Come with your loved ones. Come with family. Come with everybody. It's a love experience once again on the 14th.
To buy your tickets for the love experience with